Good morning. I am Beverly Lyles, and I'm a Senior Philanthropy Officer for the Washington Cancer Institute at MedStar Washington Hospital Center. As a philanthropy officer, I work very closely with the Cancer Institute clinicians to develop health programs and secure philanthropic support for the very important task of preventing and treating cancer. Now, while it may not seem so, I am also the face of health disparities and health inequities. I grew up in public housing in the city of Cleveland. On East 93rd, health disparities were a norm and normal. No one went to the doctor, and the doctor certainly didn't come to us. For most, sickness was a thing to bear that would either get better or worse on its own. People died of cancer, Antonio, Bernadette, and many others. Medicine had very little to do with the experience until the end. Maslow's hierarchy of needs refers to people like me as the folks in the survival mode. We are stuck on the bottom rungs of the hierarchy, ever toiling with concerns around food, shelter, safety, breathing. We never climb the pyramid to self-actualize. We get sick. We don't get treatment because we have to keep focusing on food, shelter, and breathing. Even with health insurance, we are still at the bottom of the pyramid. It is important to remember that when wondering why people are not getting preventive treatment. It is easy to think of the people we serve as the others. We connect epidemic rates of sickness, pain, and trauma with words like the underserved, the at-risk, or health disparities. In our passion for science, we may sometimes forget the human suffering that motivates the science. Events like this Making Healthcare Better community oncology event help us to remember the human part, the community part of the cancer experience. It helps us to find solutions that speak to the human part of cancer risk and diagnosis. MedStar Washington Hospital Center, as Dr. Elmer Welter has already spoken of, is one of the 50 largest hospitals in the country and the largest in the Mid-Atlantic region. Annually, we treat the highest volume of cancer patients in the District of Columbia. Our hospital is also located in Ward 5, where considerable cancer health disparities exist. Currently, for example, we have the highest rates of colon cancer in the nation in Ward 5 in Washington, D.C. And further, an astounding number of the Ward 5 residents who present to Washington Hospital Center present with late-stage colon cancer and also have health insurance, 99%. Every day as we walk through the Institute, we are reminded of their suffering. Working with Dr. Huerta, a White House champion of change and prevention oncologist, and Dr. Shockett, a gastroenterology division leader, we have developed a program that we hope can reverse the devastating effect of colon cancer on Ward 5 residents. The program, Colon Cancer Prevention in the Neighborhood, is inspired by Vice President Biden's cancer moonshot and the commitment we at the hospital share with Vice President Biden to provide timely and accessible cancer screening and treatment to all members of the DC community. Colon Cancer Prevention in the Neighborhood will offer colon cancer screening to the people of our surrounding community in their neighborhood. Using community navigators, we will bring a culturally competent, educational, and interactive colon cancer outreach and prevention program into Ward 5 with a focus on the zip codes where there are clusters. There are now clusters of colon cancer cases. Our community navigators will build alliances with community-based organizations and community stakeholders to conduct educational outreach and provide free screening kits. We're going to put it in their hands, in their communities, to return for free testing. And we're also going to provide an option for them to receive a colonoscopy at the hospital center. Our goal is to reverse the trend of late-stage disease diagnosis we experience at the hospital center, and of course, to save lives. Like Vice President Biden's cancer moonshot, MedStar is on a mission to wipe out cancer. In support of the cancer moonshot, we will work to wipe out colon cancer in Ward 5, all while providing a malleable model for colon cancer prevention that can be applied to urban communities all across the nation and, in fact, internationally. We've actually had inquiries from other countries about this program. I would like to thank Vice President Biden and his team for the immense work and the incredible momentum that the Cancer Moonshot has generated. It has served as a remarkable inspiration for MedStar Washington Hospital Center to be a part of this life-changing, life-saving initiative. And with that, it is my pleasure to introduce Don Graves, who is the counselor to the Vice President. Thank you.
Well, good morning, everyone. Okay, I know it's early, but you can do a little bit better than that. Good morning, everyone. Good morning. There we go. Thank you all for being here. Beverly, I want to thank you for that great story of what you're doing. It's great to follow a fellow native Clevelander, and it's also great to follow someone who works at an institution where both of my daughters were born. So thank you for the work that you're doing in bringing needed care to a really critically important part of the Washington region. As Beverly said, I'm Don Graves. I'm Counselor and Domestic and Economic Policy Director to the Vice President. And I want to thank you for being here today. As oncologists, radiologists, nurses, social workers, hospital administrators, and pharmacists, you're the bridge, the connector between our efforts on the Cancer Moonshot and cancer patients. We know that community oncologists treat the overwhelming majority, around 85% of cancer patients. To borrow a phrase from diplomacy, you are the last 3 feet, the ones who personally deliver the treatment and hope to people that face the devastating diagnosis. As a cancer survivor myself, I know full well. I sometimes think about that old commercial. Not only am I the president of the Hair Club for Men, I'm also a user. As a cancer survivor, I know what this means to the millions of people around the country. Any advancements in technology, prevention, detection, treatment only offer hope for patients if they get to you. So I'm here for 2 reasons. 1, to thank you. 2, because we need you. Your work is vital to taking advantage of what is a real inflection point in our fight against cancer and ending cancer as we know it. Let me explain what I mean by an inflection point. As Vice President Biden has said, when President Nixon declared war on cancer in 1971, as well intentioned as he was, he had no army, he had no resources, he had no clear strategy to win. And the system at that point was organized in the same way we have the system today. After 45 years of progress, after decades of funding, research, training scientists and physicians, treating millions of patients, because of so many of you, we now have the Army and powerful new technologies and tools. And with this moonshot, we laid out a specific strategy for the road ahead to make 10 years of progress in 5 and end cancer as we know it. After 45 years of the science, medicine, the technology are progressing faster than ever to save countless people fighting cancer. Just a few years ago, oncologists weren't working routinely with immunologists, virologists, geneticists, chemical and biological engineers, and now they are. In addition, new technologies and new therapies like immunotherapy are manipulating our immune system to target cancer cells and in the process do considerably less damage to healthy tissue, giving us hope that we can transform many types of cancer into chronic, manageable diseases, when previously they were a death sentence. And today there's a recognition not only that aggregating and sharing data from millions of patients, genomics, family history, lifestyles, treatment outcomes is wise, but we now have the ability, the technology to do this with massive amounts of data. It matters. Today we have the ability, you may not realize, actually you all may realize this, but folks who may watch this at home may not realize that we have the ability to do 1,000,000 billion calculations per second, and soon we're going to be at 1 billion calculations per second. And with this technology, we can find new patterns of causes and successful treatments of cancer. As part of the Cancer Moonshot, we've met with thousands of the top researchers, physicians, nurses, and administrators from all types of hospitals and care settings, along with patients and advocates. And in the process of doing that, we've learned that there's a consensus that the strategy we've been following is the equivalent of fighting the last war. So the Moonshot has fundamentally had two overarching objectives. First, injecting the urgency of now into this fight. Secondly, changing the culture, coming up with a new strategy to fight this war, not the last one. Nearly a year after we announced the Moonshot, we're moving from understanding the problems to making real progress in addressing those problems. We heard from so many of you that if you're not connected with one of the major cancer centers, it's difficult to know what clinical trials are available. Only 4%, as you know, of the people who are diagnosed with cancer ever become part of a clinical trial, which may be the only possibility of saving a patient's life. That's why we've worked closely with community cancer providers to understand the technical obstacles and systemic barriers you face to delivering the best care. We engaged the President's Innovation Fellows, some of the top technology minds in the world, to work with the National Cancer Institute. They spent time with doctors, patients, and community care providers to learn how to design a better way to access information about cancer clinical trials. Now, anyone can go to trials.cancer.gov, type in real words like breast cancer or leukemia, a zip code, an age, and then find a list of clinical trials near them or their loved ones that previously you couldn't find easily. You and your patients can find out what trials are available for a specific type of cancer near you. We heard from you that there are real disparities in cancer prevention, treatment, and timely diagnosis, depending on the community someone lives in when they're diagnosed with cancer. That's why we work with cancer centers in Cleveland and here in DC to bring mobile cancer screening to patients in communities across those cities who otherwise might not be diagnosed until it was too late. And we launched programs to bring new technology to individuals trying to quit smoking and live healthier lifestyles, and to continue to learn how to deliver the best care in all types of communities. The Centers of Medicare and Medicaid Services earlier this year launched the Oncology care model. I hope you all heard about that. CMS will invest nearly $6 billion in care to promote high-quality, high-value, patient-focused cancer care based on national gold standards. They've already enrolled more than 3,200 oncologists from a geographically, clinically, and organizationally diverse group of practices. We'll continue our efforts to increase access to care and to cut costs of care by reaching communities across the United States with the newest breakthroughs so your outcomes aren't wholly dictated by your zip code. And we heard from you that the investments in cures must be equal to investments in care. To help address the overwhelming psychological, emotional, and financial impacts that burden too many oncology patients and cancer survivors, that's why we worked with the American Psychological Association and others to develop a mental well-being and health intervention program to assist healthcare providers, patients, and family members to manage the stress, there's a lot of stress, anxiety and trauma associated with a cancer diagnosis, and to lessen the potential for post-traumatic stress. You all know what that's like for a cancer, for when someone gets a cancer diagnosis, the stress that they go through, the blank faces, the crying, the loss of focus, and obviously we have to find ways to mitigate that stress. Failure to identify and treat stress, anxiety, and depression may prevent a patient from getting needed treatment, interfere with the necessary immune response, produce poor quality of life, and increase the risk for disease-related morbidity and mortality. And as a part of the Moonshot, we support organizations like Family Reach, which created a financial treatment project to address the financial challenges families face when they fight cancer. This matters. No one should ever have to lie awake at night doubting whether they can balance being a patient and a parent, dreading how they're going to get back into the workforce after going into remission, or wondering if they'll have to have the ability to pay their mortgage or their house or keep their car. Because of the progress of the past 45 years, it's within our reach to provide access to prevention and screening and care. If cancer is identified, and that starts with having quality health coverage. When President Obama and Vice President Biden came into office, more than 1 in 7 Americans didn't have health insurance. Thanks to the Affordable Care Act, 91% of Americans are now covered, 20 million more people than before. And repealing the ACA will affect cancer patients, as you know. Over 1.6 million people are diagnosed with cancer every year in the U.S., and nearly 600,000 people die from cancer every year. A study funded by the American Cancer Society found that cancer patients from disadvantaged communities benefit most from health insurance. Those who have insurance usually have better outcomes. Another study published in the Journal of the National Cancer Institute showed that race and insurance status are crucial determinants of when the cancer is diagnosed, whether it's stage 1, 2, 3, or 4. People without insurance generally are diagnosed in later stages of cancer, making the outcomes much less promising. And we know that the earlier the cancer is diagnosed, the more likely it can be treated. So we need to make sure that they have health coverage. And without debating the Affordable Act here, I hope the new administration leaves in place the most beneficial parts of the Affordable Care Act, and this is one of them. Repeal and delay will put the healthcare system and millions of hardworking Americans on the edge of a cliff. The uncertainty will drive up healthcare costs, drag down the economy, and bring back the worst practices of providers and insurers that the law ended, avoiding patients who need care the most, including the cancer patients you all treat directly. Vice President Biden isn't going anywhere, as you may have heard him say earlier this week. When he was in San Francisco at the J.P. Morgan Healthcare Conference, he laid out the broad outlines of the efforts he'll undertake after he leaves office. He's going to need you, because the cancer moonshot will continue through you, in your work, in your treatment, in your care, in your prevention efforts. You'll make this momentum matter for cancer patients across the country. Let me conclude by saying I'm optimistic. The Vice President is optimistic, because we've seen how significantly, with your help, we've closed the gap in just 1 year. We're working towards the day when patients receive the best available care no matter where they live, and the disparities we see today in cancer outcomes based on income, race, and location no longer exist. You will be the ones to realize the promise of this inflection point and make that day a reality. And for millions of cancer patients, you give them that hope. I know you'll be continuing this conversation not only this afternoon, but in the months and years to come. Thank you, thank you, thank you for leading this effort. Thank you for changing and saving lives and for bringing hope to your patients and their families. Thank you for all that you've done and that you continue to do. And on behalf of all the cancer patients and cancer survivors around the country, let me just say, please keep doing what you're doing. Please keep being there, fighting the fight. I know it's sometimes hard, but you are that thin line between hope and despair for so many people around the country. So I can't thank you enough. Please keep it going. We're going to be right there with you. The Vice President is going to be there with you. Thank you, and enjoy the rest of your day.
The issue here is that we have over 16 million people a year diagnosed with cancer, and you got a whole lot dying. And the one thing that everyone has in common all around the world is this fear of cancer. And as a consequence of it, I've been able to have the great advantage of being exposed to the greatest minds in the world dealing with the fight against cancer. But we're right in the cusp of making some real dramatic changes.
Cancer is the reward we got for extending life by eliminating death from pneumonia, tuberculosis, and diarrhea in the 20th century.
It's hard to say things about cancer because there's not cancer. There's thousands and thousands, millions and millions of cancers.
We've really reached this inflection point in cancer care.
The commitment is to do in 5 years what would take 10 years.
This is not like the lighting of a flame, but the reigniting of a flame for cancer research. We're trying to cure it. We're trying to end it.
It's never a good time to get cancer, but this is a phenomenal time to be fighting it.
In 1971, when that first war on cancer got announced, we had no idea what cancer was all about. Back then, they didn't have an army, but they started a war. Today we have an army, but we needed somebody to marshal that army, and that's what Vice President Biden was asked to do by President Obama.
Vice President Biden can make sure all the scientists are figuring out how to learn from each individual patient's story with urgency.
He's known for being able to have people work together, and that's his strength.
We both believe that it's within the wheelhouse of the people in this country and the scientists in this country to actually make fundamental change.
New kinds of treatments represent important advances.
I try to find people that probably shouldn't be part of cancer research, physicists, engineers, and mathematicians, perspectives that could make that 10 years worth of progress in 5.
By encouraging all the different stakeholders to cooperate, to collaborate, and really focusing this country's resources on battling a very common enemy.
There's still an awful lot of moving parts here that we have to bring together.
There are always silos in the world. The best way forward might indeed be converting these silos into pillars and building bridges across them.
Precision medicine is using a combination of clinical data and molecular data on a patient to determine the right therapeutic strategy. But what's missing is the transportability across health systems. So you need agencies, groups, stakeholders who really have never worked together before to work together on a problem.
Share the molecular, share that patient access, learn together as one entity.
Unless they do change their ability to share their information, we're going to be having this conversation for decades. We need to have the NIH working with the FDA. We have to work with disease groups, with academic centers, and patients. The North Star is the patient.
When you get told you have cancer, it's like a bomb going off.
And he said, Ms. Hampton, you only have 6 months to live. And then I thought about it. I said, this is not going to get the best of me. I want to live.
I had to be a part of my care to want to live longer. You want to empower people even before they become patients.
In many ways, the Cancer Moonshot is a chance to take the fact that so many of us are touched by cancer and turn it into a social movement.
We're going to try to accelerate discovery and accelerate the benefits and profits that come from that discovery.
The guts that Vice President Biden has. He is an optimist, and I think that's what the world needs.
In an interdependent environment, we will make progress fast.
If you're an oncologist, by definition, you have to be hopeful.
Cancer affects all of us. It's time that we affect cancer.
Think of it this way. How many patients have said, Doc, can you give me just 2 more months to walk her down the aisle? Doc, all he needs is a month. Let me see him graduate. There's a much greater sense of urgency today, much more willingness to break up these silos than there was even a year ago.
We always had hope. And I think that's what is going to make this work. That's what's going to make this Cancer Moonshot work. It's about all Americans.
It really is. Well, actually, the whole world.
Yeah. All human beings, really.